Bony contouring for aesthetic reasons is something that we do quite often here at Wave Plastic Surgery. And one of the most frequently requested procedure is jaw reduction or mandible reduction. And these are patients who really don't have any functional issues, but feel like their jaw is too wide or too big, and therefore they want that slimming effect. A lot of times it is about at two levels that we want to reduce. The first is on a frontal view, the width. A lot of patients with wide jaw bone, their entire frontal profile does look wide at the lower part of the face, and therefore they want more narrowing. The other angle that we look at is how much of the posterior protrusion there is at the angle of the mandible. There are people with more of an obtuse angle to the jaw definition, especially on a side profile. And therefore, we do want to reduce the mandible in terms of width as well as the posterior protrusion. The way that the surgery is conducted is prior to surgery, we obviously do some radiographic imaging and therefore determine how much of the bone to actually remove. And we do remove the bony segment. In terms of like their activity, what we ask patients not to do is chew on anything hard for the first month and not to do any dental work, at least for the first 3 months. Patients are required to wear a compression garment over the face for about 2 weeks. After surgery, for a lot of patients, it's not really painful, but there will be swelling. And it does take about 2 months for about good 80% of the swelling to go down. In some patients, to get more of an effect, we do ask patients to maintain constant neuromodulators or Botox to the masseter muscles to shrink the bulk of the muscle itself. Patients who are good candidates for jaw reduction are patients who are obviously healthy, who have good dentition, who are more on the younger side, and truly has thought about this for a long time. Because bony surgery is a commitment. Any surgery is a real commitment. A lot of patients are looking for more of a significant result as well as more longevity. And in those patients, they are good candidates for jaw reduction.